Probiotics are tiny organisms like yeast and bacteria that naturally live in your stomach, intestines, and vagina. Sometimes, things like taking antibiotics or traveling can disrupt the balance of these organisms. That's where probiotics come in. They can help improve digestion and restore the natural balance of microorganisms in your body. Yum Yum Dophilus 500 million Cell-50 mg chewable tablet Antidiarrheal Formulations with gut flora microorganisms is a type of probiotic that can be used to treat bowel problems like diarrhea and irritable bowel syndrome, as well as eczema, vaginal yeast infections, lactose intolerance, and urinary tract infections. You can find probiotics in foods like yogurt, milk, and juices, as well as in dietary supplements like capsules, tablets, and powders. It's important to check the label on the product you're using to see what it's specifically meant for. As with any dietary supplement, it's important to be cautious. Some products have been found to have harmful additives, so it's best to consult with your pharmacist before using a particular brand. Keep in mind that the FDA has not reviewed this product for safety or effectiveness, so it's a good idea to talk to your doctor or pharmacist before starting to use it. When it comes to taking probiotics, the best time to take them is usually with a meal. This can help protect the probiotics as they make their way through your digestive system. As for how much to take, it's best to follow the dosage instructions on the product packaging or as recommended by your healthcare provider. When taking Yum Yum Dophilus 500 million Cell-50 mg chewable tablet Antidiarrheal Formulations with gut flora microorganisms, it's important to follow the directions on the product package. Depending on your specific product, the dose may need to be swallowed whole, chewed, sprinkled onto food, or mixed with liquid. If using the liquid form, be sure to measure the dose carefully with a special measuring device/spoon. Avoid using a household spoon as it may not provide the correct dose. If you have any questions, consult your doctor or pharmacist. If your probiotic product contains live bacteria such as bifidobacteria, it's important to note that antibiotics may interfere with its effectiveness. To ensure optimal results, take any product containing live bacteria at least 2 to 3 hours before or after taking antibiotics, following the directions for your specific product. If you're using this product to treat diarrhea caused by antibiotics, do not continue use if you have a high fever or for more than 2 days, unless directed by your doctor. In these cases, you may have a serious problem that requires medical treatment, and should seek medical help right away if your condition does not improve or worsens. Some people may experience an increase in stomach gas or bloating when taking Yum Yum Dophilus 500 million Cell-50 mg chewable tablet Antidiarrheal Formulations with gut flora microorganisms. If this persists or becomes worse, it's important to notify your doctor or pharmacist. If you experience serious side effects such as signs of infection or a serious allergic reaction, it's crucial to seek medical help right away. Signs of a serious allergic reaction include rash, itching/swelling, severe dizziness, and trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects, it's important to contact your doctor or pharmacist. In the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Yum Yum Dophilus 500 million Cell-50 mg chewable tablet Antidiarrheal Formulations with gut flora microorganisms, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that can cause allergic reactions or other issues. If you have ongoing diarrhea for more than 2 days, especially if you also have a high fever, or if you have a weakened immune system, recurring vaginal or urinary tract infections, consult your doctor or pharmacist before using this product. Be cautious if you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid sugar and/or aspartame, as liquid products, foods, powders, or chewable tablets may contain these substances. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use this product when clearly needed and discuss the risks and benefits with your doctor. It is also important to consult your doctor before using this product if you are breastfeeding, as it is unknown if this product passes into breast milk. It's important to be aware of potential drug interactions with probiotics like Dophilus 500 million Cell-50 mg chewable tablet Antidiarrheal Formulations with gut flora microorganisms. Some medications that may interact with certain probiotics include antibiotics, antifungals such as clotrimazole, ketoconazole, griseofulvin, and nystatin. Always consult with your doctor or pharmacist before starting, stopping, or changing the dosage of any medicines. Remember to keep a list of all the products you use and share it with your healthcare providers. If you or someone else has taken too much of this medication and are experiencing severe symptoms such as loss of consciousness or difficulty breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., you can reach out to your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Make sure to attend all your medical and lab appointments as recommended. In addition to the gut flora microorganisms, some versions of Dophilus 500 million Cell-50 mg chewable tablets may also include other ingredients like fiber or inulin. If you're unsure about the specific ingredients in your brand, it's best to consult with your doctor or pharmacist. If you forget to take a dose, take it as soon as you remember. If it is almost time for your next dose, skip the missed dose and take the next dose at your regular time. Do not take double the dose to make up for the missed one. When it comes to storing probiotics, it's important to follow the specific instructions on the product package. Some probiotics need to be refrigerated, while others do not. If you're unsure about how to store your probiotics, don't hesitate to ask your pharmacist for guidance. And remember to keep all medications out of reach of children and pets. When it's time to get rid of your probiotics, make sure to do so properly. Don't flush them down the toilet or pour them into a drain unless directed. Instead, dispose of them when they're expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.